Welcome to this deep dive, where we unpack what you need to know.
Great to be here.
Today, we're looking at something quite new, a therapy being tested for kids with ADHD-like symptoms.
Specifically symptoms linked to prenatal alcohol exposure.
Exactly. Our source is an announcement from UCLA Health. They've started a clinical trial.
And this is really important work. We know standard ADHD treatments often, they fall short for these children.
It creates a huge challenge for families, doesn't it?
It really does. A significant unmet need.
Okay, so let's get right into it. What's the scale of the problem here?
Well, the numbers are quite sobering. Prenatal alcohol exposure, it affects roughly 5% of children just in the U.S.
5%? Wow.
And many of these kids develop symptoms that look very much like ADHD.
You mean things like hyperactivity, being impulsive?
Yes, exactly. And also big difficulties with executive functions, attention, memory, staying organized, planning things out.
And the really tough part, as you mentioned, is that the standard ADHD medications often just don't help much.
That's the crux of it. Dr. O'Neill over at UCLA, he highlighted this. He described these symptoms as potentially highly disabling.
And they often fail to respond to standard treatment, like the common stimulant meds.
Precisely, like methylphenidate. So families are often left without effective options. That's why exploring alternatives is so critical.
Which brings us to this new therapy they're testing. What is it called?
It's called trigeminal nerve stimulation, TNS for short.
TNS. Okay, and how does it work? Is it invasive?
No, that's a key point. It's non-invasive. It involves delivering very gentle electrical stimulation to the trigeminal nerve.
The trigeminal nerve, that's on the face, right?
Yes, on the forehead. It's done using small electrode patches worn while the child sleeps.
So they wear these patches at night?
Right. The patches are connected to a small battery-powered device.
Okay, stimulating a nerve on the forehead.
Yeah.
How does that connect to, attention and behavior?
That's the really interesting part. The idea is that stimulating this nerve activates certain brain regions.
Which region?
The ones known to be involved in attention and those executive functions we talked about. It sort of modulates brain activity.
And is this approach completely new? Has TNS been used before?
Good question. Actually, no, it's not brand new in concept. An external TNS device was cleared by the FDA back in 2019.
Oh, really? For what?
For improving ADHD symptoms generally in kids aged 7 to 12. So there's already some evidence for its safety and effectiveness in that broader group.
Ah, okay. But the big question here, the focus of this specific trial, is whether TNS works for kids whose symptoms stem from prenatal alcohol exposure.
Exactly. That's what makes this UCLA trial unique. It's a first of its kind, zeroing in on this particular group.
Can you tell us a bit more about the trial itself? Who's running it?
Sure. It's led by Dr. Joseph O'Neill at UCLA's Semel Institute. Its planned as a 2-year study.
And how many children are involved?
They're aiming to recruit 30 children aged between 8 and 12, all with confirmed prenatal alcohol exposure.
And funding. Research like this isn't cheap.
No, it isn't. They have an initial grant of $350,000 from the National Institutes of Alcohol Abuse and Alcoholism.
Okay.
And there's potential for quite a bit more, up to $2.1 million, if these initial results look promising for a larger trial.
Makes sense. So what do the families actually do in the study?
For 4 weeks, the parents will use the device, it's called the Monarch eTNS, on their child every night.
Okay, nightly use for a month.
Yes. And during that time, they'll be tracking things very carefully.
Like what?
Changes in executive function, definitely.
Yeah.
But also sleep patterns, any side effects, though it's generally considered safe, and just their overall satisfaction with the therapy.
So a pretty comprehensive look. It sounds like there's cautious optimism.
Absolutely. Dr. O'Neill has stressed the safety record of TNS. And, there's real hope this could provide a much-needed option.
Another researcher was quoted too, right?
Yes, Mary O'Connor. She also expressed a lot of enthusiasm for the potential impact this could have on the kids and their families, improving daily life.
That's the goal, isn't it? Now, if someone listening thinks this might apply to their child, is recruitment still open?
Yes, it is. Recruitment is underway.
And how can interested families find out more or see if they're eligible?
There are a few ways. They can email childbrainstudy at mednet.ucla.edu.
Okay, email. Any other options?
Yes, they can call 3-Enduro-267-2710. Or there's an online screening form they can fill out.
Do we have the link for that?
We do. It's https.bit.litns-PAE.
Great. So just to quickly recap then, We've talked about this real challenge, treating ADHD-like symptoms in kids exposed to alcohol prenatally. Standard stuff often doesn't work.
Right, and this UCLA trial is looking at a non-invasive alternative, TNS, used at home during sleep. It's really the first study of its kind for this group.
A potential new tool for families who really need it.
Exactly. And thinking bigger picture here, if a non-invasive therapy like this proves effective, well, it makes you wonder, doesn't it?
Wonder about what?
Well, think about it. Could these kinds of non-invasive brain stimulation approaches help with a wider range of conditions, beyond just prenatal alcohol effects? Conditions impacting focus, behavior, maybe even learning.
That's a provocative thought.
Yeah.
What other ways might we find to gently modulate brain activity without drugs or invasive procedures in the future?
It certainly opens up some interesting possibilities to consider.